other that forms a noise which we call a murmur. And a physician can usually hear a murmur by listening to the patient's heart. Again, very important to go to your physician and have your heart checked out, once a year, or have a physical exam once a year, because these murmurs could be detected. You do not need a specialized test just to detect a murmur.
But if you're 79 years old,
right.
Is it still a good time to deal with it?
Absolutely. It's never too late. Once you detect a murmur, you need specialized testing like echocardiogram that Dr. Steinhubel specializes in, and he can talk about that a little bit further.
Yeah. So, Robert, definitely there are many things that can be done, and there are many different types of murmurs, some benign, so not dangerous, and some can be dangerous, and not only increasing your risk for a heart attack, but causing heart failure. There are some murmurs that need to be fixed before you have symptoms from it, from the leaking heart. And because once you start having symptoms, even when we fix them, then your heart doesn't get back to normal. And then other murmurs, even you wait until you have symptoms. But it's very hard to tell just by talking. But by an ultrasound of your heart, which is very simple and not painful, the doctors will be able to tell you exactly what that murmur is, exactly what needs to be done. Typically, the best fix for a murmur or for a valve leakage or blockage is going to be through surgery. But in the early stages, good medical therapy can delay the need for surgery. And now they're just starting a little bit beyond the experimental phase of placing valves percutaneously, so through a catheter, a large catheter, through the leg. And there are several centers in the country and around the world that are starting to do that. So that's a very exciting future area of research.
All right, we have another call right now from Louise in Phillipsburg. Welcome, Louise, to Smart Talk.
Hello. Yes, I have pains across my chest, but at different times I've had the stress test twice, and they tell me it's anxiety attack. If I take a cold drink of water, it goes right away. And I also have a heart murmur, but they did an EKG, and I'm fine. So I just wonder, can you have a anxiety attack that feels like a heart attack?
Thanks, Louise. How old are you, by the way?
75.
Thank you.
So, yes, there are many reasons of having chest pain. Anxiety could be one of the reasons. There could be fluttering valve, what we call mitral valve prolapse. It's basically a slightly loose, you can say, valve leading to a mild form of leaking that does not generally need surgical intervention. It could be just treated or observed with medications. You might not even need meds for that. That can also sometimes lead to having atypical chest pains like Louise has. Other reasons could be some disorder with the swallowing pipe. There could be spasms of this that, again, could be treated with medication. So having chest pain does not always mean that you're having a heart attack, but I think the medical opinion should be sought to make sure to differentiate it from, for example, gallbladder disease sometimes can cause that as well, and we commonly see that in emergency rooms in our practices. So these things should be differentiated. It should be made sure that it's not coming from the heart and what is the reason for having these pains. So yes, anxiety can cause it.
Mike, I wanted to ask you, over the last 7 years, what have you experienced? Have you had any pains? Are you more cognizant of your heart? And as Louise said, do you sometimes feel, I'm sure coming on a TV show tonight, maybe you had a little bit of, you know how the blood pumps and your heart does seem to be going, just natural nervousness. But what have you experienced over the last 7 years?
Well, fortunately, I've experienced none of the symptoms that I had experienced before. The shortness of breath has not been an issue, but I also make certain that I get enough, well, not enough, but I get some, never enough, cardiovascular exercise. I've had only a little bit of angina over the period of time, but very, very little and very infrequently.
What that is? I've heard angina. What is that?
Angina is basically chest pain.
Okay.
Yeah.
So, and when do you experience
that? But very
that?
little.
So when you have a blockage in the artery, that can reduce the blood supply to the heart, so decreased oxygen, decreased nutrients going to the actual heart muscle, and the response of the body to that is having chest pain or angina.
Mm-hmm. And what do you do when you have that, though?
And I haven't had angina for a long time, and when I experienced it, it was not too long after the surgery. I wonder if that is typical.
It could be. I mean, you can, have angina sometimes, or you can have just chest pain from healing of the heart, and it could be mistaken for angina. So many reasons for having chest pain does not necessarily mean that it's angina.
But in answer to your question, I was given nitroglycerin tablets to use in the event that I was experiencing that, and on a few occasions I did use them. It may not have been necessary, but I did anyway because it's always in the back of your mind.
I just want to ask you a philosophical question too. When they came to you and said you do need to have surgery, your heart the heart is the hardest pumping organ in our body. It does a heck of a lot of work. But beyond that, it's sort of our emotional core. And when someone said, your heart needs to be operated on, just what went through your mind? What were you thinking about as you underwent that?
Well, it was a surprise. I thought that I had, even though I'd had a history of heart disease in my family, I thought that having reached the age of 62, that I had probably passed the time when that would be an issue for me. So it was a surprise. I had great confidence, though, in the technology and the procedures of the time, and especially hearing about the successes that they were seeing in this minimally invasive procedure being done in New York and now being done here.
A lot of people say they have depression afterwards. There's something about having your heart operated on that can actually psychologically get you. You didn't have that happen to you?
I have to say that my recovery was very brief and relatively easy.
And you had heart surgery. So I just want to make sure that you say that one more time, that your recovery was great after heart surgery, because many people are very afraid when you talk about heart surgery. So I was actually going to ask Mike that question, and I'm glad you brought it up yourself.
Especially if you look at the video and you're looking at these surgeons
right.
who are actually manipulating the human heart. That's one of the reasons you said you went into medicine, because
right.
you can actually do some things. The heart has a lot of different pieces to it. But that's pretty freaky in a way,
It sounds freaky, but medicine has come so far these days. I mean, you talk about the team of people that is involved in doing heart surgery, or for that matter, cardiac cath or angioplasty, the nurses, the physician assistants, the nurse practitioners, the ancillary staff. At every level, the medical care has improved so much. So much safety has been built into it. Pharmacist can put a drug into the computer, and all of a sudden he'll know what interaction a patient can have. Similarly with us, we have checklists that we go through. We've gotten better in reducing the amount of injury to the body. The pain control with surgical procedures is so great. So I'm really glad that you came to the show today and saying that...
the type of surgery that I had, in my understanding, contributed to the fact that I had less pain than might be normal and that I recovered faster. I was not on a heart-lung machine during the surgical procedure, correct?
Right. So that is another new thing or technology that has come into heart surgery, that we do not have to put a patient on a heart-lung machine anymore to do heart bypass surgery. We can do a beating heart operation, and that does lead to a better early recovery. Right. So for people, our audience out there who are nervous about the prospect of heart surgery, I think we've come a lot further in medicine as general, and heart surgery in particular, that our recovery time, our outcomes, the risk of, for example, a bad outcome, risk of dying from heart surgery in Pennsylvania is less than 2%, and that has improved over time, over the last 10 years in our state.
That's very encouraging. We have another call right now from John in Mechanicsburg. John, welcome to Smart Talk, and what's your question or comment this evening?
Thank you. My question is, should I be concerned because the last 5 EKGs that I've had show an inverted T wave? Now, if I may explain briefly, I went to a cardiologist several years ago, had a nuclear stress test, an echocardiogram, and about an hour's worth of test. Everything looked great. My cholesterol's good. Its total cholesterol is 130. My blood pressure's good. I'm 69. I'm in great health. But the last 5 EKGs have all shown a consistent inverted T wave. Should I be concerned?
You want to take the one?
Sure.
What's a T wave, by the way? Without getting too technical.
A great and complicated question,
okay,
but let me say really quickly, it's fine. So when we do the electrocardiogram and we look at the electrical patterns of the heart, it tells us a little, essentially, which pathways the electricity is taking, and the electricity has to go different ways through heart muscle that is scarred, so had a heart attack before, or is not getting enough oxygen. And so the typical EKG looks at your heart in 12 different locations, so it's called a 12-lead EKG. In some of those leads, it's completely normal to have an inverted T wave. But for many people in the atypical leads to have the inverted T wave, so the T is just, there are 5 different parts of the electrical pathway of the heart that we follow. The T wave is the relaxation part of the contraction, the heart contraction. And when we look at that, we normally expect it to be upright, but like I mentioned, in many leads it's negative, and for some patients it's just normally negative. Eating a big meal can invert your T waves, hyperventilating can invert your T waves, or it's just the way you are. So do not worry at all about 5 EKGs in a row with inverted T waves. That's not a sign of anything bad going on in your heart. You've done everything else right. Just keep up doing what you're doing.
One of the things that I think is interesting, you were a chemical engineer and then you got into this. You said I like pipes. Yeah. And there are lots of different pipes sticking together in the heart. And there's lots to work on.
And there's a lot of the physiology and a lot of things to understand about how the pumps, how it works as a pump and how the pipes work and how we keep the pipes clean. It was a lot easier as an engineer.
He's a plumber of the heart.
Yes,
you gotta love it.
Yeah.
Donna is joining us now on the phone from Ridgeway. Welcome, Donna, to Smart Talk.
Hi. I have a question. I have COPD, and I have atrial fib. I had all this corrected once. It's taken me a long time. I have 2 heart doctors, which I'm very fond of. I've been in the hospital now for gallbladder. Not surgery, just pain. Now I find out that my heart is back out of rhythm. Will that correct itself, or is that something I have to worry about?
Okay, thanks for your question.
So that's the most common rhythm disorder in the United States. A lot of morbidity associated with it, with this heart rhythm disorder, atrial fibrillation. It can lead to clot formation inside your heart, which can lead to stroke. So that's why patients go on Coumadin, which is a blood thinner. It also causes problem if you are on Coumadin and you need a surgery, you need to stop Coumadin, and all those issues go with it. So most common rhythm condition in the United States, also lost a lot of cost involved to that. Generally, if you've had atrial fibrillation for a long period of time, you do go in and out of this heart rhythm. Even though you were controlled beforehand, if your body undergoes some other stress, you can easily go back into this irregular rhythm, and that's why the medications and the Coumadin should need to be continued in patients with this particular disorder. You cannot stop these medications saying that I am back in rhythm because there's no guarantee you're going to stay in rhythm. Mm-hmm. These days we have treatments beyond medications that we can utilize. One is called catheter ablation, which is utilized by colleagues of Dr. Steinhubel. The other is surgical atrial fibrillation ablation that surgeons like myself offer, which is again performed in a minimally invasive fashion. We use a camera.
Quickly, what ablation is?
So ablation is essentially that you create a scar tissue inside the heart from where you feel this arrhythmia is coming from. You either use a heat source or a cold source inside the heart on the non-muscular sort of chamber of the heart. It's the top 2 chambers where this arrhythmia commonly comes from, and these are not highly, they are made of muscle, but these are not the main pumping chambers of the heart. So by creating these scar tissues, you prevent the irregular heartbeat from traveling towards the muscle part of the heart and putting the patients back in regular rhythm. Potentially that can obviate or does not necessitate the need for Coumadin in the future, but we are working on further studies to see whether that is completely safe or not.
Real quickly, we talked a little bit about lifestyle. One of the things you mentioned was exercise, regular exercise. You told me that actually the exercise is helping you to grow small blood vessels, which was part of your problem. You didn't have a lot of small blood vessels, and that's what you needed?
My doctor tells me that he thinks one of the reasons that I'm doing as well as I am, of course, who knows, is that because I do get enough exercise or do exercise, that he describes my particular circumstance as small vessel disease, and that the bypasses really